Hello everyone, welcome to the workshop at the BioTouch Center. This month our subject is opioid addiction. I think we're all aware of what a serious subject this has become throughout our society. And tonight Paul and Bev will be telling you some of the history and the story behind what we're facing today. And of course you'll be learning the points to help address that. Tonight our speaker we are proud to have as a returning speaker, Eileen Webster. She is one of our own. She is an intern, which means she's on her way to become a certified practitioner. Eileen is a registered pharmacist. She practiced for decades, not to tell on her age or anything. Years and years, just years, in Colorado, in rural Colorado. And she has been really great as a speaker, and we were so happy to have her back.
Eileen? Most recently, though, I did get certified in opiate addiction and recovery as a way to refresh my memory on all this, because as a pharmacist, you do become a robot after a while. So back to the basics. This opioid epidemic that we're all talking about has spared no one. It affects people of all genders, how about both genders? All races, all ages, even newborn babies are being born dependent on opioids. It affects not only the patients, but their families, their loved ones, their friends, their bosses, their co-workers, their doctors, the clinics that have to treat them, the EMS that responds to all of this, the police that have to get involved, the court systems, everyone is being affected directly or indirectly by this epidemic. So how did this all happen? Well, initially it was in part due to the over-marketing and over-prescribing of opioids. And then with the increased availability of drugs like heroin and fentanyl and carfentanil, that has been directly associated with the most recent rise in overdose deaths. So this is not only scary, but it's getting scarier and scarier. So back down to some of the basics, some of the terminology, because again, I am a pharmacist. So this is how I'm going to approach this, and so take notes. No, I'm kidding. So first of all, what are opiates versus opioids? Well, opiates are natural extracts of the poppy plant, the opium poppy, hence the name opiate. Okay, now opioids, though, are any substance, be it natural, like from opiates, or from poppies, or synthetic, like made in a lab. And opioids, again, are any substance that binds to the opioid receptors in the body. So why do we have these opioid receptors in our body in the first place? Well, that's because our bodies also make their own natural opioids, and these are called endogenous opioids, known as, well, the most popular ones you know of are endorphins and enkephalins. And these are important in regulating body functions like respiratory depression, sedation and wakefulness, constipation, or, if you don't really want to say constipation, but we'll just say regulating colon efficiency. Sedation, and most of all, what we're all used to is how they work on euphoria and pain control. So these receptors in the body, when these opioid compounds bind to them, it's a lot like a lock and a key. If the key fits really, really well into that lock, it can turn it on, off, fast, slow, however it wants. It can really get this cell going, or activate the receptor to activate that cell and get it going. Now, just as a side note, there are also what we'll call, or pardon me, let me back up a second. So when these compounds bind like that and activate these receptors, we refer to those as agonists, okay? And then there's these dirty guys that we refer to as antagonists. And what those come in, they come in and think of it more like a broken screwdriver. Someone comes in, jams that into the lock, and occupies that lock. It can't turn the system on, but another good key can't come in and activate that lock. So it just jams up the system, okay? And that's known as an antagonist. So now how does all this relate to pain relief? Well, pain is weird. Pain is not really pain, but it's a warning signal. So each of us has a brain, a nervous system, or brain, a spinal cord, and sensory nerves that monitor your internal environment and your external environment for like temperature, vibration, pressure, etc., things like that, And then we have specialized sensory nerves that are called nociceptors, meaning noxious receptors. And what these guys are for is detecting potentially damaging levels of stimulus. So they won't respond to normal pressure, normal temperatures, but if it detects that this is a potentially damaging level of these, then they send that danger signal through the nerves to the spinal cord up to the brain. And then in different centers of the brain, it starts having this conversation about, well, what exactly are we feeling? Okay, I felt a poke in my ribs. Well, what's the situation though? Am I having fun? Or am I angry and upset? Am I walking down the street alone and there shouldn't be anyone around me? Or is my husband sitting right next to me? So this conversation that's going on in your brain helps to determine exactly how much of a threat it decides that this stimulus is. And if it decides it is a potential threat, it will then turn it into that sensation of pain. And that sensation of pain then goes down, is sent down the rest of the, sent down the spinal cord out to the body parts for you to respond appropriately to the stimulus. So again, if it's that your foot's near a fire and it's just kind of getting warm, it'll tell you just gently move it back. But if it feels that that's burning your foot, you'll jump back. Or if I detect that is my husband tickling me in the ribs, I'll elbow him in the... So anyways, it's just to get our attention so that we'll take the appropriate action. So how do opioids work for pain? Well, when we take an opioid, when we're in pain, it travels through the bloodstream to these special sensory nerves. There, it gets in there and turns those locks off so that these nerves are slowing down and they're not transmitting that warning signal up to the brain anymore, or it's transmitting it much more slowly to the brain. And then when the message gets to the brain, the receptors in those parts of the brain will turn on neurotransmitters like serotonin and norepinephrine to tell you, it's really not that bad. All's well. It's okay, we don't need to worry. And thus, it doesn't process it into that pain signal, and then you don't go on with the process of writhing in pain. Does that make sense? Okay. So now, how do they cause euphoria? Well, there's another part of the brain where when it hits those receptors, it will turn on the release of dopamine. And dopamine is our neurotransmitter or hormone of pleasure. So our brains are wired for reward with the release of dopamine to provide these feelings of pleasure when we engage in activities that promote basic life functions like eating and sex. So it's to keep you doing these things that keep you alive, not necessarily to keep you using a medication to keep you happy. Does that make sense? Okay. So now, tolerance. How does tolerance develop? Well, tolerance is when an increasing dose of a medication is required to produce the same pharmacologic effect. So you're getting used to the drug and it's just not having the same effect on you. And that's because your body wants to keep everything status quo. It wants to keep everything in balance. And so when you start having these higher levels of opioids in your body, it starts detecting that there's too much stimulation of these locks, and it adapts by turning down its own production of endorphins and enkephalins because it doesn't want you to be overloaded with the external ones and your natural ones. You see what I mean? And so to prevent a overdose that way, it drops down your levels to try to bring body processes back down to normal. And then, I just lost my train of thought. But it will also adjust how well these locks and keys bind together and how well they function to turn on and off these processes. And so, oh goodness, I apologize, folks. I so lost my train of thought. Okay, so after a while, when this tolerance develops, it's now going to require more opioids, stronger opioids, and even more frequent doses of them to maintain that same level of pain relief or that same level of euphoria, and even to maintain the sedation and the respiratory depression. Okay, so again, the more you take, you're building a tolerance to those effects, okay? To the analgesia, the euphoria, the sedation, and the respiratory depression. And that's really important for when we come down the road into overdose. So, but first of all, what is dependence? So, well, as this tolerance process increases and the body's ability to adapt is exceeded, and it becomes, okay, so the body's ability to adapt becomes exceeded, and it becomes completely dependent then on that external source of opiates to be able to function normally and to prevent withdrawal. So does that make sense on dependence? Kind of got tongue twisted there, I apologize. Okay, so then what is withdrawal? Okay, withdrawal is what happens when a person is physiologically dependent on opioids and they decrease their dose or they stop using it for some reason or another. And this will cause signs and symptoms opposite to that of acute intoxication or therapeutic use. So instead of feeling euphoric, you become very dysphoric. And instead of feeling happy and calm and relaxed, you feel restless, anxious, irritable, and depressed. And instead of relieving pain, there's rebound pain and muscle aches and heightened sensitivity and reaction to pain. So again, that brain process is now overfiring on those pain signals. And then instead of slowing your bowels down, constipation, you become very nauseated and have vomiting and diarrhea. And then instead of subduing the immune system, making you feel better, you feel very sick with watery eyes, runny nose, chills, sweating, fever. Oh, horrible, horrible, horrible place to be. And that's part of why folks will relapse, because the withdrawals are so unbearable. There's, people refer to it as sickness. But also that the severity and the onset of these withdrawal symptoms will depend upon the level of dependence the person has developed to their opioid and the specific opioid that's being used. So say, for example, the ones that you take every 4 to 6 hours for pain, like Vicodin or codeine or something. Those are out of your system fairly quickly. So they'll produce symptoms within hours, or withdrawal symptoms within hours. And those withdrawal symptoms can last days, several days, even weeks. And then the other ones, the long-acting opioids, the ones that you take like every 12 or 24 hours, like, OxyContin or Cadian, or even those 72-hour patches that you change out, every 3 days. Those last so long in your body that once you stop using those, it could take several days or even weeks, it could take several days. Instead of hours, it'll take days for the withdrawal to begin, and then it's going to last for many weeks into months. And then that's just the acute phase of it. That's just the top, just the beginning. Then, in the lingering phase of it, these are the symptoms of just the constant fatigue and poor appetite, insomnia, depression, the inability to feel pleasure, and the lack of motivation. And this could last for several months. Some say even up into a year or so, as the body and brain functions slowly return back to normal. So, how does all of this lead to misuse and abuse of opioids? Well, in the early stages, it's the stimulation of this reward system. That's the primary reason people take the drugs repeatedly. But then the brain begins to develop memories, positive memories based around the circumstances, the people, the drugs themselves, everything that was going on when they were taking those drugs. And that leads then to increased craving for these drugs when they re-encounter those situations. They expect the same kind of fun. If they go to that concert again, it's got to be that same kind of fun. And so they want to have those drugs there. But there are many, many other factors, both individual and environmental, that can influence whether a particular person who experiments with opioids will continue taking them long enough to become dependent or addicted. There's economical issues. Oh, heck, social, family. I don't want to get into that because I'm not a drug and alcohol counselor or a psychologist, but many things can contribute to why a person is medicating not only their physical pain, but their emotional pain with opiates or opioids. So, now addiction. Well, addiction is the compulsion to use opioids in spite of many obstacles or adverse consequences. So it's now gone beyond just that drive for the pleasure, and it's now become about the tolerance and the dependence, but most of all, just avoidance of withdrawal. They just don't want to get sick. They don't want to be addicted, but they don't want to be sick. They're not getting high and happy from it anymore. They just don't want to get sick. So what is detoxification? Well, detoxification happens when the opioids are stopped and the body's processes slowly return back to normal. And most people, when they think of detoxification, they're thinking of the medically supervised opioid withdrawal programs. So that would be like your methadone clinics or inpatient or outpatient recovery programs. Like that. So anyways, what they do is they use medications to reduce the symptoms of withdrawal and to reduce the cravings as the offending opioids are being slowly stopped, or however they're being stopped, and while they continue the recovery process. So common medications used for this process are, say, methadone, we've all heard of, and methadone is a synthetic opiate that's administered in a clinical setting. It's a once daily dose that they take in place of their favorite opiate or opioid. And then over time, again, that one's slowly tapered off as they're ready to come off of it. Another one is buprenorphine, also known as Suboxone or Butrans. These are also synthetic opioids, like methadone, but they have a special little quality in they not only replace the offending opioid, but they act like that antagonist, that broken screwdriver, and block those receptors from any other opiates being able to activate it. So if they're taking Subutex or whatever, they may still feel a little bit of their euphoria and such from that one, but again, it's going to keep them from taking the ones they were buying off the street or their favorite ones they were abusing, and then their doctor is going to work with them to, again, slowly taper them down off of it. Then we have our naltrexone and naloxone. These are the ones, well, actually, naloxone, also known as Narcan, or Evizio, pardon me. These are the ones that we use in overdose. Well, an overdose, what is that? Well, that's toxicity due to excessive opioids. It can occur intentionally or unintentionally. We used to associate it with people out in the streets overdosing, but it can occur in patients who don't even have an opioid use disorder. It can happen when people mistakenly take too much of their medication, or the pharmacist may give them the wrong one, or the doctor may even write for the wrong medication, or a child could get into someone's medications. But the scariest reasons overdoses occur are because of the tainted medications that are out there right now with fentanyl and carfentanil. These are so potent, as they're saying, amount equivalent to a couple grains of salt could kill you. So then the other scary reason for overdosing is someone who's already been through a detox program. Their receptors have returned back to normal, but their cravings haven't stopped. And when they go back out and they relapse and they take those doses they thought they were used to, they don't have those tolerances anymore. It now will knock out their breathing. And then that's when these scary situations happen. So how do you recognize an overdose? Well, we look for what we call the overdose triad, and that's the decreased level of consciousness, pinpoint pupils, and respiratory depression, or they may not be breathing at all. How do you manage an overdose? Well, first you determine if this person can be aroused. And if they can't, try the aggressive sternal rub or just some way to get them aroused. If you can't arouse them and you think that for any reason, maybe at all, opioids might be involved, this is when you bring in the Narcan and the Avizio. I'm not going to pronounce that one right. Avizio. So, determine if you can wake them up. If you can't, administer the Narcan or Avizio. Call 911. Provide rescue breathing if it's necessary. And stay with them until help can arrive. Because you need to stay with them because the Narcan will only last 4 hours. And depending upon which opioid they overdosed on, it could be one of those long-acting 12-hour ones. So if we only block it for 4 hours, when that wears off, they could be right back into that overdose. So it's important to keep watching them and to have extra doses on hand. Not just one, but extra doses on hand. And again, resuscitation should be continued until the paramedics arrive. Now, I could get into how exactly to use the Narcan nasal spray or the injector, but I'd like to skip forward into any questions anyone might have.
What happens if you give Narcan to someone and it turns out they didn't overdose?
Good question. Nothing. Absolutely nothing. Because that's all it will do is just block those receptors and knock the opioids off. And so if there's no opioids in their system, it will do nothing to them. But now that you mention that, if they... Well, no, I won't go that direction either. I apologize. So, does that answer your question? Okay.
We need to wrap it up so we can teach them. Wow, it's too good.
I apologize. So I could go on, and if you do have any other questions about it, you could always email me or give me a call and ask. But I'd like to now hand this back over to Paul and Bev and how we can work BioTouch into this.
Perfect. Thanks, Bill.
Oh, that was amazing. Wow. As usual, I always learn so much from these.
You moved the chair.
Oh my gosh.
Wow,
Are you
that was a lot.
That
Are we
was-
on stage here? Okay.
awesome? That was
So,
awesome.
Interesting about, so we did have a drug counselor, one of our first presentations. And when Eileen talked about the endorphins and things like that, that's what Paul Appleby always said was BioTouch activated those endorphins. And so what we're going to teach here today with BioTouch, how many people have never had BioTouch? You've never? Wow, we have
Frank,
a couple of new.
You haven't had BioTouch, have you? No BioTouch? You haven't had BioTouch? No?
Nope. All right, so we got some newbies here.
Yeah.
So the other part of it is the addictive nature. And so Paul Appleby used to bring us to the drug, this is at Coke down here downtown. And we used to work with them as they were coming off their different drugs and things like that. And he just, BioTouch to him was just what was amazing in drug rehab. We did have a fellow, his daughter brought him in here. He's on heavy oxycodone, like 2 times the recommended dosage for pain. And it wasn't 2 sessions, and he cut his OxyContin in half. And then bought the book, wherever it was sitting right here. Oh, here it is. He got the book, because we're not going to tell you a lot of the history about how I met the man who created the system that we call BioTouch today. We talk more about that in the whole practitioner training. But he bought the book to find out, what is this stuff going on here? And just to let you know, he actually said he hadn't read a book this good since Louis L'Amour. So if you know Louis L'Amour, if you don't, then the story is pretty meaningless. But if you do know Louis L'Amour, that was a real compliment, because the book was written to really reach the masses of people, to reach the people who were addicted to any kind of drug or pain, and to help people so that families could help one another. And that's what we're going to do, teach you here today, is how to go home. Does anybody have someone who's on opiates that they know of? Oh, yes. So hopefully you'll be able to feel confident to really go home and help, because, well, Bev will give you the details of it. But so the guy actually started cutting back on his OxyContin. Now, BioTouch is about consistency with it too, because he quit coming in. So all these things Eileen was talking about, triggered in there. So BioTouch is not this Narcan, stick it in you kind of a thing.
Right.
It's really about learning something that you can do at home. And that's what these classes are designed to do. The workbook you have there that Bev's going to go over here in a minute is taken from our whole manual. This is the get out of here. This is the whole manual of all the points that you see up there on that chart. Okay? What we've done for these workshops is taken a particular health condition, and then we've made these little workbooks that you have so that we can just teach you 2 or 3 sets of points for that condition. You don't have to know the whole book. You don't have to know all the terminology. We have other classes to take you through that. But these were designed just to really focus on a particular condition. And then we have speakers like Eileen. And Eileen, that was great. I mean,
Yeah, that was wonderful.
I looked at the clock, it's like, oh my God, it's 30 minutes already. But so we really appreciate all of you coming. And what we're going to do is we're going to just start learning the points. Any questions about anything yet?
Oh,
Okay.
there will be. Maybe.
Oh, there will.
Yourself?
Huh?
Can you do the points to yourself?
Can you do them to yourself?
Go ahead, answer that.
I know
So-
the answer.
Oh, you know the answer.
Yeah, she already knows
She's
the
planting the seed.
answer. Right.
So BioTouch is a technique of touching another human being. That's the technique. What you do with the points after that is up to you. Okay, but what you're going to learn here today is how BioTouch is taught around the world. And our important job here is to keep it simple. This technique, and I'll just give you a little bit of the history, was created by a mining engineer in Colorado. And I met him in Colorado. He was a chain smoker, chain coffee drinker, ex-John Bircher, loved hunting and killing animals. And when I met him, I was the town hippie, loved peace and tie-dye. Brown rice and broccoli kind of a guy. And so here's the hippie guy meeting this, mining engineer, ex-Navy guy. And he helped me with a back problem. And I just said we had to get this technique out to humanity. And it was really instigated by this little old timer guy who said Norman and Carol brought love to the Mancos Valley. I mean, people were coming from all over the Four Corners to get what at that time didn't have a name. And so, I was sort of, as I said, the stooge to get it public. And that's 30 years now. Is that what we decided, 30 years?
That's
So it's been 30 years, and it's just beginning to take off. And so classes like this, we're really excited that you've come here to want to learn it, and that you'll be able to pass it on when you're done this evening.
mhm.
So go ahead, Deb. Let's just start teaching.
So we can open up those workbooks, and the first page, it says, what is BioTouch? So as it says, BioTouch is a simple, hands-on, so everybody just reach over and just take those first two fingers and just lightly touch your neighbor on the skin like a butterfly. Just touch somebody. Yep. Yeah, Howard. Help them out back there. Yeah. And that's really what it is. It's this light touch on the body that, I don't know, just seems to activate something. It's communication system. It activates the body to do what it inherently does, which is bring itself back into a wholeness, a balance. So,
It reminds me of what Eileen was saying. It's sort of one of those keys that hits that cog that she talked about.
yeah.
And as she's talking about that, I'm like, well, that's a bite. It hits a particular cog that, helps with the, we'll show that after we do the points, but it sort of breaks the connection to the pain messages without the side effect part of it. And we did research specifically on those kinds of things with pain and stress reduction.
Right. Now, because it's totally non-invasive, BioTouch, that light touch is just when you touch on the skin, like I said, it just stimulates the body to do what it knows how to do. So in that, we keep it very simple. We'll just go down these bullets here. BioTouch is easy to learn, even children. And we've had that happen many times. We've had children. I always think that we're all children, and that's why BioTouch is so important to all of us. It's very innate in us to want to help another human being. And BioTouch lets us do that. It helps us to have a relationship, a healing relationship with another human being, because both of the giver and the receiver of BioTouch, it's a win-win. So it's more than just this, the body gets better and then all of these other things begin to happen. So children get it. It's just wonderful to, as Paul was saying, we're getting this into families. That's the foundation's whole purpose, is to share this with families so that they can, in their own groups, help each other anytime. It doesn't cost a dime. It costs nothing, and it brings people together. That's one of the most magical things about BioTouch. It can bring us together. It's a complement to any healthcare program. We don't use the word alternative. We use the word complementary, because it can only enhance anything else you're doing, whether it's another modality, whether you're on, under a doctor's care of some kind, whatever's going on, BioTouch is only going to enhance that healing process with that. So Paul and I have been, saying that for us, it's becoming integrative. That's a big catchword now, right? Thanks to Dr. Weil. Integrative and holistic. WHOL, because with BioTouch and that self-awareness, everything starts right here on the skin at the body, and then other things happen with consistency. Those other parts of ourself begin to respond as well.
And I think that's the important part, is the consistency with it, along with the medical care. So people who are on opioids or pain relief kinds of situations, This is not something, you know, we're not saying do BioTouch and just throw your medication away. But it's about letting your healthcare practitioner know, you know, I'm doing this other thing too. Can we work and cutting me back? You know, can we work on helping the body detox? BioTouch will be a really good thing to help you get rid of that buildup that Eileen was talking about that sometimes could take months for it to get out of your system. So BioTouch can actually enhance what we've seen. If it's a 3-month time the body gets rid of it, well, if you use BioTouch with the medical care, it could be half that time. You know, and many times it is without the huge side effects of withdrawal. So we really want people to work with their counselors or their healthcare practitioner or their doctors while they add BioTouch. Yeah.
So obviously you would look at how the body is responding as an indication for maybe the duration, not meaning the duration of each treatment, but the duration of how many months, let's say, you're receiving the treatments. But what frequency would you go with? Every day? 2 days?
You get to choose.
Yeah, right.
Really?
Yeah.
Yes.
Because you can't overdo it.
Okay.
You know,
Yeah.
and I mean, if somebody is in an overdose situation, you might do it every 6 hours for a while.
Yeah.
But then you would taper off and feel, you know, are they sweating? Are they sick? We're going to give you the basics to work with, but you might add, if they're nauseous, you might add another set of points, not necessarily what we're going to teach tonight. They might have pain in other local areas as they're withdrawing. So then you can just decide.
Yep. So BioTouch has no levels of ability, and everyone, I think that's the awesome part of BioTouch. Tonight, you're all going to give and receive BioTouch. You're going to be totally effective the very first time you touch that other person. So we've all got it within us to do BioTouch already. It's innate. It's there locked in us, and BioTouch brings out of all of us this amazing healing process, this process of self-awareness. So everyone is effective, and that's why we really are working to get this to humanity, because it's like this gift waiting for everybody. The kids can work with moms and grandmas and, you know, Uncle Joe, whatever's happening, it can make a difference in our daily lives. And so it's really it's vital. BioTouch is vital for us to get it out to people. So everyone's effective. And the reason is because there's no levels of ability. There's no, you know, mastery levels. There's nobody that's ever going to have to sanction you're good to go after 5 years of doing something. It costs next to nothing to learn BioTouch. And so we are making it very available to everyone to learn it and to use it with their families, with their friends, whatever spheres of influence you go into. You can take BioTouch with you. You can work with anybody, anytime, anywhere. And without...
We have a friend who does it in a bar.
Yes.
She does it for tips instead of the dancing. That's what she goes around. These guys have pains, and she'll just do BioTouch on them, and that's what she works for her tips. And then she'll work on all the girls who do the dancing too. She's always like, you shouldn't tell people that. I'm like, but it's such a
so
perfect
awesome.
story
I know.
that BioTouch just works anywhere.
So to share BioTouch with other people, you don't need like a certification or anything. No.
Right. After, like I said, we're making it very we're making it very available. You can go on our website and you can learn how to do it on your own. You can take classes. You can come to these workshops and learn specific sets of points for a specific condition. So there's lots of ways that you can learn BioTouch. And
then we can just share them.
And then you can just share it.
Yeah.
Yes, that's the beauty of it. You don't have to take a, formal class, go to a formal classroom. We do have opportunities for those who want to do that, but not everybody on this you know, and humanity is going to want to take a class. So this is for them. This is for everybody to learn. The last bullet is that BioTouch requires no preparation, no belief system, which is just really awesome, because when we just step up to another human being, you know, you don't have to prepare yourself. You don't have to smudge yourself. You don't have to clear anybody. There's nothing that needs to take place. You're just touching. That's all that's required. Just want to help another human being.
So it's interesting because I have a radio interview tomorrow, and the woman's asking me, she says, "So you consider yourself a healer?" And I said, "Huh?" I said, "No, I don't." She said, "Well, how am I going to introduce you?" I said, "How about a human being that just wants to help other human beings?" And it was sort of like it didn't fit in the paradigm of, "Oh, we're going to interview you. You have to be somebody. You have to be a healer. You have to be a professional or something." And what's beautiful about BioTouch is, just like you said, that's it. If there is such a thing called a healer, you got it.
Yeah.
You're all healers.
Yep.
You all have the ability to help another human being now. It's powerful.
I know. It's true. And I think that just about covers everything. Yeah.
Any questions from those who haven't been around BioTouch before, or who have and have trick questions?
Right.
All right.
Well.
So we're going to teach some points. There's basic things here about practicing, and then we're going to show you the points. And the first one is we always wash our hands, and it doesn't have to be, you know, soap and what. You just have to wash your hands, and then it's one person always touching another on the skin. That's always the way that we do it. And then, as it says there, you just use these two fingers. There are a couple of sets where we're going to use the whole hand, but it's basically these two fingers, and it's touching points on the body. And then, as it says, it's a butterfly-like touch, and the points are done for 6 to 8 seconds. The whole goal is just to calm yourself down so it's not this kind of a thing.
Right.
Okay, so 6 to 8 seconds at any set of points. And like it says, it can be practiced anywhere. So we're going to actually bring our little dummy over here. No, I'm going to go over there. Wait, who is the dummy here?
Yeah, she does.
And you can turn to your first page there. Now that set there about terms and things, you don't need to know that. It's just there to show you that we do have a terminology as we're teaching this. No, you teach the points. Yeah, it's on us.
Okay. All right. Okay, so the first and most important set we're going to learn is called the greeting. And this is like the key. Remind me of what Eileen was like. This is the key that begins to open the body, and it becomes offers a harmony between the practitioner and the recipient. And so you have to use the greeting before you do any other work on the body. Before you touch any other points, always do the greeting. So you've washed your hands. This is going to be the only set you're going to use one hand, and it's going to be your dominant hand. So you figure out what's your dominant hand, left, right. If you're ambidextrous, you can choose. There are only 2 points in the greeting. Use the same hand for both points, okay? If you happen to need to walk away and come back, give the greeting again. If you're in the middle of a session or middle of working with somebody at home and the doorbell rings, come back, give the greeting again, and then just continue where you left off. So you always want to just do that set. So the first point in the greeting set is located just in that soft tissue just below the breastbone. So a little soft tissue right there. And we're going to, again, take the first 2 fingers and lightly touch, holding 6 to 8 seconds on point 1. Okay. Point 2 is on the back. And we're going to locate it there's this, what we call the big bone at the base of the neck. If you bend some people call it C7. You're going to be going about 1 to 1.5 inches to the left of that big bone. And again, holding 6 to 8 seconds very lightly on point 2. And now you can begin to do whatever you want to do, whatever sets of points. So, any questions?
Did you do it at the same time?
Do
Both points at the same
no,
time?
you do point 1 and then point 2. Yeah, I guess you could, but no.
Okay.
So that's the greeting set. Any questions about the greeting set? If you do nothing but the greeting set with someone, you're going to have done something for the body. The body's going to have some kind of a reaction to the greeting set. It's very powerful. So, okay. So let's turn the page. What is the next set?
So what we've given you is the order of priority for the addiction part.
Right.
Okay. And
Right.
so the next page is the stress.
The stress set. Yeah. Okay. The stress set is very simple again, but very effective. So again, this is, the anxiety, stress that's going to come up, whatever's going on with that person, we can address. So again, we're going to find the whole point, and it's going to be in that point number 1 of the greeting, that soft tissue just below the breastbone. And we're going to be touching 2 points on the left side of the body. If you imagine a line, diagonal line, it shows it in the book, just coming from that notch at the top of the breastbone, it comes down to a place on the left breast where we say a nipple on a youth would be. So you're going to divide that line into thirds, and you're going to touch point 1 and hold that lightly 6 to 8 seconds. And then you're going to touch point 2. And again, 6 to 8 seconds. You can repeat the points as many times as you feel you want to. You go back and forth as many times as you want to. Just hold each point 6 to 8 seconds. Am I holding it? That's it. Very easy. That's a stress set. Any questions about that? Pretty easy so far. And the next set is, so we're going to do the poison set. Yes. This will help the body to detox, as Eileen was talking about. Again, a very simple point. I guess it would be 2 points in this case. But the whole point, so a whole point is where you're going to rest your fingers on a point on the body, and it's going to have constant contact with the skin, while the other hand is touching points, or what we call sweeping. So that whole point is going to be greeting point 1 again in that soft tissue. So we're going to keep our fingers resting on that point, and on the right side of the body is that large muscle. You're going to be working along the large muscle. So for the poison set, which is that third little inset diagram there, you're going to be holding at the base of that muscle 6 to 8 seconds. That's point 1. Point 2 is just to the side of that muscle, directly at the top of the neck. And again, you can repeat this as many times as you want to, holding 6 to 8 seconds with each point.
And it's always on the right side?
Yes. Yes. Did you have a question?
I noticed you're using your dominant hand yet for that.
Once you do
Once
the
the greeting is
greeting,
done?
you
Okay.
can use any hand you want. That's a good question. Thank you. Yes. The only set that you need to use one hand, your dominant hand, is with the greeting. Once you do that, yeah, whatever you want to do. Any questions about the poison set? And this will help the body to, get rid of toxins and
And this has to be
poisons.
done on the right side.
Yes, always on the right side of the neck. Yep. What's the next one? The metabolism. So this is a great set because it helps the body to get rid of what it doesn't want and to bring in what it needs. And this is a great set to use. Those first two are awesome, the poison and the stress, but this is a good one too. So there's 2 steps in this set. The first step is we're going to be working along those large muscles along the front of the neck. And we're going to be touching points in what we call matching fire. So we're going to be holding 2 points simultaneously and lightly working along the throat because it's very sensitive. So the first 1 and 1, points 1 and 1, are going to be right in that indentation above the collarbone. Everybody see that? Yeah? 1 and 1. 2 and 2 is halfway up the neck. Again, we're going to be working along that large muscle. And 3 and 3 is at the top of the neck, beside that large muscle.
Where
One-
are we in the book? Is that the?
Yeah, that's it.
We're on the first step. Yep. First step of the metabolism. And then you can repeat those points again. And I'll just say this at this point. We teach the technique in a certain way all the time, very consistently. But once you really start working with BioTouch, it doesn't matter the order of the points as long as you do all the points in that set. So, if you were 1, 2, 3, you're still doing all 3 of those points, which is what you really have to do. But the order doesn't really matter. So just make sure that you do that. So that's step 1 of the metabolism. So we've worked along the front of those large muscles, and now we're going to be working on the back. So we're going to find a whole point. We're going to be holding on the front of the body and touching points on the back of the body. So in order to find the whole point, remember that nipple on a youth? Well, we're going to imagine a line between where the nipples would be on a youth, and we're going to be about a third of the way, about 1 to 2 inches to the left of the breastbone. We're going to rest our fingers on that point, and we're going to be working in what we call through fire. So we're holding on the front, working on the back. So we're actually working through the body. So we have a reference point, and it's called the breakover. You're not going to see it here, but it's called the breakover. It's where the ribs join the spine. The bottom of the ribs join the spine. And you can find that. It's straight through the body from breathing point 1. So you can just imagine that. You're going to just kind of keep that as your reference point. We're working below the shoulder blades and above the hips. So point 1 is going to be about 2 to 3 inches above that breakover point on the left spine muscle, and we're going to stay below. So here we go. So we're holding on the front, and we're touching point 1, holding 6 to 8 seconds. Point 2 is directly across on the right spine muscle.
Is where you're holding in front, is that the breathing point?
No, this is that on that line where the nipples on a youth would be, and about 1 to 2 inches to the left of the breastbone.
Okay.
So you're. So point 3 is going to be, I guess it's one. I'm sorry, it was 1 to 2 inches, wasn't it? Above the. So 2. I could see all you guys. 2 to 3 inches now. We're 2 to 3 inches below the breakover point on the right spine muscle. So point 3 is about 2 to 3 inches below.
And again, do these have to be done in a specific order?
I don't, no. As long as you do all 3 points, I could do 1, 2, 3, whatever comes to me. We teach it this way so that we have consistency. So 1, 2, and 3, and that's the metabolism. And again, you can repeat those points as many times as you want.
But choose the 4th point.
Right. That's called the blood sugar point, which doesn't really have anything to do with what we're teaching tonight. But yeah, it is a valid 4th point in this set. It addresses blood sugar. This whole metabolism set, yes, for blood sugar and for that. So, any other questions?
And you're always just using these 2 fingers.
Those 2 fingers very lightly on the skin. Yep. Good.
Okay, and then the last set, if you get it in there, again, all of these are in order of if you're dealing with the situation. If you have time to do all these, great. If not, you do at least the stress if somebody's having a problem. The headset works on that whole brain thing, the whole endorphin thing, the whole mind neurological system. So when you're really looking for the long-term work here, the first 2 points are mostly like emergency care, and then you start getting into metabolism and the headset to really start helping the body regenerate its health and to get rid of the addictions and to have a body that's healthy enough to let the addictions fall away so that you don't have a lot of the symptoms that Eileen was talking about. So the headset is a very powerful set to do. So step 1, and again, we're going to practice all these, is A and A. Okay? A in the front is right at the crown, where the crown meets the forehead. And then A in the back is if you go right at the base of the skull, in the middle of the neck, is the other A. So that's step 1, A and A, and you hold that for 6 to 8 seconds. Is that shown in there? That's A and A. Okay? Now this might seem real complicated, but you're going to notice the points are done, and then they're just done in different ways. So there's not a lot of points, you just do them in different ways. So now we're going to do what we call a crossfire. You see that X at the base of the skull? Choose a side, and you're going to be at the base of the skull on the side of the large muscle. Doesn't matter which side you choose, because then you're going to touch points on the opposite side of the head. So I hold my X there, while my points 1 through 5 are on the other side. Point 1 is just straight up from the corner of the eye, and we're going to follow this ridge line where the side of the head meets the crown. And you can feel that on yourself. It goes from the side, and just before it turns up, there's this ridge line. So point 1, point 2 is on that ridge straight up from the front of the ear. Point 3 is straight up from the back of the ear on that ridge. Point 4, you're going to drop about 1/3 of the way down the ear and 1 inch or 2 back. If you feel on yourself, you'll feel an indentation in there. And then you go to point 5, which is at the base of the skull, the side of the large muscle. Guess what? You're on exactly the opposite of that hold point, that X. And here's a really neat trick, because now that becomes your hold point while you touch the other side. Point 1, point 2, three, then you drop down 1/3 of the way down, and now you're back 5 and X. You're at the base of the skull, side of the muscle. And now you just do those points again, except now you do them in a matching fire. So now you do 1 and 1, 2 and 2, 3 and 3, 4 and 4, and 5 and 5. So you've just done these points in different ways. And as you can see, you've really been working on that whole brain and pituitary center and the endorphins and everything else in there. Step 5 is one of the only times we use our whole palm, and we're just covering points 1, 2, and 3. Questions about that? Let me turn this off and then we'll practice points.